I know Secretary Brainham has spent her life really committed to helping those with dementia and Alzheimer's and to helping caregivers. So not only is she doing that now as the secretary, but prior to coming to the Department of Elder Affairs, she was with the Alzheimer's Association, so truly has been committed for many, many years to this cause. So we're going to show a video that she videoed for us, and then I'm going to introduce Cari.
Hi, I'm Michelle Branham, Secretary of Elder Affairs, and I was supposed to be with you all today. I am so sorry I can't be there, but as you can see behind me, Tallahassee is experiencing some really, really bad weather. We've had some tornadoes and a couple of things that were severely damaged. So right now we are at a senior housing location, making sure that all of the residents are taken care of and that we're making sure they have food, shelter, electricity, and everything they need to be okay. So sorry folks that I can't be there. I know Eyre is going to be with you. She is our statewide dementia director. So I'm looking forward to her talking with you today. And what you're doing is so important. So I'm so grateful that you all are gathered together to talk about caregiving. Caregiving couldn't be one of the more important things to me. I came from the Alzheimer's Association, and I witnessed firsthand for almost a decade the real courage, tenacity, and absolute amazing heroism that caregiving takes. And it doesn't matter the kind of caregiving. Caregiving is such a love from the heart. It's a deep, deep personal commitment. And even whether you do it personally for a family or a member or a loved one, or you're doing it professionally, it takes a special, special human being to be a caregiver. And I know, as you know, that being the best caregiver you can be means taking care of yourself first. So you're going to get all the tools here. You're going to talk more with people, be in fellowship and communion with folks that'll help you not only be the best caregiver you can be, but also train others to be great caregivers as well. The Department of Elder Affairs is dedicated to making sure that we live well and we age well in the place of our choosing. And that's not just a saying, folks. That's more than a saying. I want it to be a reality. I want us to choose where we live. I want us to age well. I want us to age not only with dignity, but inspiration, enthusiasm, activity, and a promise for a wonderful, wonderful future. I know being a great caregiver is one of those ways that we can tackle living well and aging well in the place that we want to live for as long as we want to live. So my commitment to you, being the Secretary of Elder Affairs, is to constantly keep that mission close to my heart. I think about you every day. I think about the work that we do in all parts of Florida. Again, we're here today in crisis, but there'll be blue skies again. I know there will be. But today we need to take care of those folks. So I wish, like I said, I could be with you, but we're here just taking care of our people in Tallahassee. So I want you to learn more, be in networking and community and conversation with each other. And I can't wait to hear what comes out of this amazing conference. I want to especially thank Charlotte Mather-Taylor because she does an amazing conference, her and her outstanding team. There are just some people that shine super bright, and Charlotte Mather-Taylor is one of them. I also, if I can't be there, the greatest gift I can give you is Eyre, our dementia director. She's fantastic, and she's flying on her way down. I'm supposed to be on the plane with her, but I'm not. But she's on her way down to see you soon. So looking forward to you having that opportunity as well. I want you to reach out to us if you need anything, because you'll hear a lot about the Florida Alzheimer's Center of Excellence through Cari, but there are all special ways that we provide services and wraparound support to caregivers throughout the Department of Elder Affairs and its area agencies on aging and all of our partners and providers. So from me to you, I'm sorry I'm in the rain, sorry I'm here, sorry I'm not with you, but I just appreciate, see, the light just came on, so we're getting some electricity. I appreciate all you're doing. Have a wonderful conference, and I'll look forward to hearing from you all soon. Thank you.
My name's Cari, Eyre, and I am humbled and grateful to serve as the state's Dementia Director at Elder Affairs. And you just saw my boss there on the video, Secretary Branham, and like Charlotte said, she so badly wanted to be with us here today, but as you could see, she's in the midst of the storm. They had some really terrible storms come through on Friday. That was when the brunt of the storm hit. We still have lots of people up there without power, so please keep them in your thoughts, and more storms are coming today. So it's a little bit dicey up there. So I'm very happy the sun is shining here and everything is going well today in this neck of the woods. But in these few days since the storm cleanup, we've been pivoting and reorganizing and rescheduling all these different events, and it occurred to me just how poignant it is that one of the things that was involved in this rescheduling was an event for caregivers, because nobody understands the importance of having a flexible schedule and adapting on the fly to an unforeseen challenge like a caregiver. So I know that many of you have been in that perpetual state of shifting schedules and changing deadlines for weeks and months or even longer. And so before we get started talking about the programs at the department, I just want to begin by validating that many of you may have had your own challenges in getting here today, and I really want to thank you for making it happen, to get here, to be here in fellowship, to talk about the challenges of caregiving, and to be a part of this community. So thank you for all that you are doing for your loved ones. So as we get started, I want you to just take a couple moments and think about your role as a caregiver. I want you to think about the person that you're caring for. I want you to really picture them. I want you to think about the space where you do most of your caregiving. And I want you to think about all the other responsibilities that you have. Many, many, many other responsibilities, because I know caregiving is not the only thing that you're doing. And in your role as a caregiver, what is it that you are trying to accomplish? What are you trying to convey to your loved one? Well, most caregivers tell me that they just want their loved one to know how deeply cherished they are. They want their loved one to know just how much they appreciate all they've given to the family and all that they've done throughout their lives. That can be really tough though, right? Because sometimes we are so deeply focused on just getting through the day, getting through the task in front of us, or getting somewhere on time, or keeping an appointment, that the things that we are most trying to convey, the things that we said that we wanted to prioritize, end up taking a back seat to the daily grind. Does that feel true for anybody? Yes, me too. So I want you to go back to my first question. Who are you caregiving for? And now I want you to put yourself there. You are the first person who needs to receive care. You're going to hear this over and over again today. It always bears repeating. You have to take your own oxygen first. You can't pour from an empty cup. But we're horrible at taking that advice. That's why we dove into caregiving in the first place, because we want to help others. So we do have to say it again and again. Probably every person to step up here today is going to say those same words to you. And I don't say it to be redundant. I say it because it's truly important. It's the first thing that we have to take care of. We need to convey to ourselves the same sense of urgency, those feelings of love, gratitude, and compassion. That's where we need to begin. So while you're here today, of course I want you to think about your loved one's needs, and I want you to think about your many other responsibilities. It's impossible to turn that off completely. But please take today to prioritize yourself. Enjoy the beautiful spring air. Enjoy this beautiful theater space. I love getting to come and visit this gorgeous theater. It's one of the most beautiful places I ever get to talk. And I want you to enjoy your lunch and enjoy coffee with other caregivers who understand the journey that you're on. So I want to tell you a little bit more about the agency, the Department of Elder Affairs, and I want to tell you about the work that we do with Charlotte and her amazing team at the Area Agency on Aging. So we are a small health and human services agency up in Tallahassee. To give you an idea of our size and our scope, we serve 6.3 million residents of Florida who are 60 years of age and over. We only have about 500 people working for our team. And so for a little bit of perspective, the Department of Health has about 13,000 people who work for their team. So we are trying to do a lot with a little. But there is a very important growing elderly population here in Florida, and with that comes a higher prevalence of Alzheimer's disease. We have the second highest prevalence of Alzheimer's disease in the country, with more than 580,000 Floridians and their families affected by the disease, and Broward County is one of the most prevalent within the whole state. So this is truly a hotspot for more reason than one. And we are very fortunate that Secretary Branham comes into her role with nearly a decade of work in the Alzheimer's space. It's a topic that is very close to her heart, and I have not ever seen a more tireless champion for Alzheimer's work than our secretary. It is truly a passion project for her, and it's that commitment that ensures that our programs get the recognition and leadership support that they deserve. And one of the ways that we do that is through the Older Americans Act Title III programming. So you heard Liz up here speaking a bit before lunchtime about all the different services that are available through the AAAs, and that's one of the ways that those programs make their way out to the community through partnership with the Department of Elder Affairs. And those are the comprehensive support services for family caregivers and grandparents. The main one that's focused on caregivers is known as the National Family Caregiver Support Program, and there's a wide range of services that are available there. Recently, Secretary Branham had the honor of testifying before the U.S. Senate Committee on Health, Education, Labor, and Pensions. They call it the HELP Committee. And she was there to advocate for the reauthorization of the Older Americans Act so that seniors and their caregivers can continue to get these critical support services. This is really the foundation for all the services that we offer. So it's very inspiring for me as somebody who works on that team to see our leadership there at the table. We were the only state agency represented that day. Our department also offers Alzheimer's and caregiver support programs through state-funded initiatives, and many of which are unique to the state of Florida. And I am very proud that Florida contributes more to its Alzheimer's spending than any other state in the country. We have the greatest commitment, no matter how you slice it, per capita, per dollar, every way you want to look at it, the state of Florida contributes more to this topic than any other place. And that whole continuum of services is able to meet the changing needs of individuals and families affected by Alzheimer's and dementia. Now, don't get me wrong, we still have a long way to go, but it's very encouraging to see that when it's time to advocate for increased support, that the folks that we talk to already know just how important it is. The services that fall under the Alzheimer's Disease Initiative include the respite services for caregivers, which can be found in every county, all 67 counties of Florida. It includes caregiver training. It includes our network of 17 memory disorder clinics, one of which is Broward Health, so you're going to hear from that team in just a little bit. It also includes the comprehensive diagnostic and referral services through those memory disorder clinics for persons with dementia. Just a couple of years ago, the governor established the Florida Alzheimer's Center of Excellence, which is available to assist families who plan to provide care at home for their loved ones with all types of dementia. And I'm going to tell you more about that program in just a little bit. I'm going to tell you all the nuts and bolts of it and how we're doing. But it's part of a bigger initiative from the governor that has continued throughout this latest legislative session, when he recommended in his focus on Florida's future budget $6 million to serve additional seniors and their caregivers through the ADI funds, and an additional $2 million to that FACE program that I'll tell you more about in just a moment. So you heard before in the panel before lunchtime, the simplest way to find out about all this information is simply to access your area agency on aging. I know they gave out the telephone number. It's also in that booklet, so don't lose your pamphlet from today. It's got all the telephone numbers, and there's an easy access telephone number from no matter where you are across the state. You can just call 1-800-96-ELDER. You do not have to be an expert. You don't have to know what you're looking for. You just pick up the phone and the person will guide you to the resources that you need. So that's kind of the big picture concept of the Department of Elder Affairs, and I want to shift a little bit now to tell you more about the work that I do specifically in the Alzheimer's and dementia space. So I joined the team at DOEA back in 2021 when the state leadership passed some legislation that recognized the prevalence of Alzheimer's around the state, and not only the disease itself, but the impact that caregiving has inside our communities and the way it impacts our state's infrastructure. So they called for a position known as the Dementia Director, And I was and continue to be very honored to serve as the first person in that role. And so it's a big topic, as you all know. And so you might think it would be hard to prioritize and know where to dig in and get started. But we actually had a 5-point dementia action plan laid out by the governor. And when I stepped into the role in 2021, the first 4 action items had already been achieved. So I had my marching orders. I was supposed to start with number 5, which was to establish a Center of Excellence in Alzheimer's Care. And this is a really large, massive project. It's going to roll out over several years, but the foundation is now underway. And most of the time when we use phrases like Center of Excellence, you might think of like a pristine research laboratory or an academic institution. And though those things certainly have their place in the Alzheimer's world, really what we need today, most of all, is excellent care at home. Because that's where our loved ones want to be. They want to be with us. They want to be surrounded by familiar things and people who know them and love them, even if they can't remember all of the details. That's where people want to age, and that's where most families have a financial need to age in place. So the foundation of the Center of Excellence model is really to ensure that caregivers have all of the support they need to fulfill that role. And we started that work right here in Broward County in 2021 with the AAA, with Charlotte and her team, and a company called NAN Cares. And NAN stands for Navigating Aging Needs. And the concept is really pretty straightforward. We pair a highly knowledgeable care navigator to a family caregiver. And they're connecting over the phone. They can do video conferencing if they choose, but most people prefer to just do the phone call, because then you don't have to do your hair and makeup and the whole 9 yards. You can just pick up the phone and get the help you need. And so it's always the same care navigator. You don't have to repeat your story. You don't have to make a new connection with a stranger who's picked up the phone on that particular day. It's somebody that you grow to know and to trust, and who understands your family's situation and won't judge your situation. They're there to help you solve the problem that you're most dealing with at that time. These care navigators also have access to what we call the NAN experts. So this is a clinical team. These are registered dietitians, these are counselors, pharmacists, psychiatrists. The whole gamut of clinical services is available, so that when there's kind of a more elevated need that arises, the care navigators have that phone a friend capacity, and they can reach out through that direct pipeline for help and answers. And then the care navigators meet with the family caregivers at regular intervals to ensure that we're not only addressing the current need, but we're adapting as needs are changing, and we're also trying to anticipate what's coming next and prevent any of those crisis moments from occurring. So this work so far has been incredibly successful. After 12 months, the families in this program have reported a tremendous array of improvements in their outcomes. So I'm going to give you some numbers. They have reduced hospital admissions and falls by 80%. They've reduced anxiety and depression by 60%. They've improved the number of advanced directives in place with families by 80%. And they have increased strong financial planning in families by 50%. Family caregiver stress, which is measured by a tool that we call the Zaret Burden Scale, showed a 40% improvement in stress levels despite the progression of the disease. So, if those numbers don't mean a whole lot to you, what I'll tell you is this. A panel of experts found these outcomes to be so substantial that the work was selected for the Alzheimer's Association International Conference last year in Amsterdam, and the team got to go and present their findings in front of researchers from around the world who are looking at different avenues to improve care for people with dementia. Now, as a government employee, I feel obligated to tell you that I did not get to go to Amsterdam. They said, you're going to sit at the bench while the team goes. But maybe they'll let me go this year because the conference is only in Philadelphia. And actually, the numbers are a little bit better. So if I don't get to go to an exotic location like Amsterdam, at least we can present some even better outcomes in the second year than the first. So we're very excited to see that work continue. And that program is continuing to grow throughout the state. So in addition to the work that we do with NAN Cares, we now have our own team of care navigators who work with me at the Department of Elder Affairs. And they are stationed throughout the state so they can serve as regional experts of the resources that are available inside their own communities and help families get paired to those services. And so they get trained from the NAN Cares team. They use the formal NAN Cares protocol. They have access to the NAN Cares software so that we're following that very strong clinical protocol that we know is working really well for families. One of the things that I value the most about that program is that it is completely flexible. We have very, very few criteria to be admitted into this program because we know that caregiving is as unique as the family that's living through it. If you were to turn to the person beside you today and share the details of your caregiving situation, you might find that you have a couple things in common, but really the framework of your care plan is going to vary quite a lot from one person to the next. So we want these care navigators to be able to address the issue that's most pressing for you before we dive into that prescriptive protocol. So we can get into the nuts and bolts of the actual care plan after we've solved that sort of crisis that prompted the phone call in the first place. So I want to tell you the story of one of the first families that we helped in this program. And this was someone who reached out to the department not because of a caregiving concern, but because they were really worried about the increase in their housing costs. Like so many people around the state, they were really, really stressed that their rent was going to go up and they didn't know how they were going to make those payments and they didn't want to have to move. And so after a few times of repeating that story, they ended up saying, well, because I'm caregiving, it would be really hard to move my husband. And so then the red flags are going up, right? Then we know that we have an entry point to get in and help with this family. So it took a couple phone calls before we actually got her into the FACE program. But it turns out that this was a wife caring for her husband, and he had early stage cognitive decline. And she was an amputee, and she had a prosthetic leg. So she was really struggling physically with the demands of caregiving. That's a challenge at the best of times, and she was really, really struggling. She was also very petite, so just the physical demands were quite a lot on her. They also had a really big truck, and she couldn't drive this truck because it wasn't set up with the adaptive components that would allow someone with a prosthetic leg to drive this car. So the husband with early stage dementia was driving the truck, and she was navigating. Now, I hope I don't have to tell anybody here how dangerous that is. I'm going to do it anyway. That's very, very dangerous. So please, if you're struggling with driving, don't resort to something like that. Get with a professional who can help you come up with another plan. Because we knew that was the first thing we had to solve. This was the first piece. This was very, very dangerous because they didn't have another way to get around. Then we learned that they were having some confusion about their health insurance, so we connected them to a Shine counselor. These people are amazing, and I know that the Shine team is here today, so if you've not ever connected with Shine and you have questions about insurance or Medicare, that's the best place you can go for help. So we got them connected to the Shine counselor. They did a little bit of digging and discovered that this family had accidentally taken out 4 insurance policies for the same coverage. They were paying 4 times over every month. Then we learned a little bit more and found out that this truck, this unsafe truck, had a really, really, really high monthly price tag. And so that was just really eating into their family budget. And she didn't like it anyway because she couldn't drive it. And so the care navigator worked with this family to help them come up with some different transportation options. She ended up selling the car and getting something smaller that could be modified and could be driven with the prosthetic, and that was enough for her to get around. So I tell you this story to tell you that the most challenging problem may not be about my loved one forgets things from time to time, or my loved one is not wanting to go to the doctor's appointments. Yes, those things are true, but sometimes the most pressing concerns are something that just far eclipse that, and we can deal with those other questions after we've gotten through the really acute problem. And so I really, really value that our state allowed us to develop a program with that level of flexibility, that we could get in there and do some creative problem solving, because we really couldn't do anything about the increase in her rent, but we sure could help them figure out a better way to meet that new demand in their family budget. And I could probably stand up here all day long. I could take the rest of the conference and tell you stories about the families that we've helped and the many varied and unique ways that these challenges present themselves, but I know that you have your own stories. And so I just want you to think of a challenge that you've encountered as a family caregiver. And I want you to ask yourself, were you able to solve that problem alone? Probably not. Were you able to solve it with a single phone call? Probably not. These are challenges that stay with us for a while, and we need people to be on the journey throughout the whole process, so that as needs change and new challenges present themselves, we don't have to start from scratch every time. And that's what these care navigators are really intended to do. We want them to be with family caregivers as that trusted guide and touchstone. So I'll just tell you quickly, I told you it's very short, so it's very, very quickly the criteria to get involved with this program. You or your loved one needs to be in Florida. That's a basic one, but they don't even have to be here yet. You could just be moving them here and trying to get your house ready, so that's still okay. The person needs to have some type of cognitive decline, but it doesn't have to be a formal diagnosis. It could just be that you're concerned about it and you need a pathway to get the diagnosis. And then the third piece is that you plan to provide care at home for as long as possible. So this is not a service to help transition someone into an assisted living facility or skilled nursing facility. There are definitely programs out there that can help you do that if that's what you need, but this particular program is intended to help people who have a goal of keeping their loved one at home. And the entry point is pretty simple. Again, you just reach out to that elder helpline. Like I said, the number is in the brochures that you all got today, and the easy reach out telephone number is 1-800-96-ELDER if you want something that you can commit to memory. So through my work, I often have the opportunity to connect with other states to hear about what they're doing, and we share resources with one another, and we try to find creative ways to meet challenges. And I don't know if the person who asked about Georgia resources is still here, but if you'd like to talk, I do know the folks in Georgia and would be happy to help you connect with them. But we meet every month. In fact, we actually just had a meeting yesterday. So when we get together, I am always so proud of the innovation that we have here in this state and the collaboration that we have at the local level through the AAA. And so I just want to tell you a couple other quick pieces about work that's going on inside the department where we try to bring that collaboration to the table. So we work on a project called the State Health Improvement Plan, and that is housed at the Department of Health, but we co-chair that Alzheimer's disease priority area work group because we have our own singular priority on that work. And I think Jennifer Braystead, our co-chair, there she is. Jennifer Braystead is our SHIP co-chair with the department to focus on those efforts. And through that work, we bring together all types of people. There's all types of professionals. There are family caregivers that come into that work and try to find ways to meet needs throughout the state. There's 3 goals within our priority area. The first one is to strengthen the capacity to address the disease through our infrastructure. The second is to ensure a competent workforce. And then the third is to enhance support for the people living with the disease and the family caregivers. And now we're beginning to take that work inside the State Health Improvement Plan and dovetail it with the work of our Dementia Care and Cure Initiative task forces. So this is another place where Broward County really shines because there's a very strong DCCI task force right here. And these are community members who are coming together regularly to try to find ways to make this community more dementia friendly through events like today, through education and empowering events, through doing training at business businesses so that when you take your loved one out into restaurants and other public spaces that you know it's a safe place for them to engage. So if you are here today as a professional and you are not connected to DCCI or to SHIP, this is your open invitation. We would love to have your voices at the table. Caregivers are welcome too, but you all have a full plate. So I'm really directing that invitation to professionals who might have the capacity to lend a little time to that effort. At DOEA, we're also responding to the legislative changes for Alzheimer's and dementia training inside licensed care facilities. So we had a bill passed last year that required a new 1-hour class for all direct care workers, and we've trained more than 50,000 people across the state of Florida with that new particular piece of training. The bill also tightened some of the other training windows, but that was the big element of the bill. We're also working with our network of memory disorder clinics to respond to the increased funding that they got. So we want them to be able to expand their reach and do more evaluations, to do more education, and be more present in their communities. And to also expand the reach of their research efforts, because we know that the first person that will be cured of Alzheimer's disease is going to be a person in a clinical trial. And we really, really want to see that happen in Florida. We're working with the team at the Florida Department of Law Enforcement to implement a training for first responders so that when they encounter somebody with dementia out in the community, maybe it's somebody who's driving when they're not supposed to be, maybe it's somebody who went into a grocery store and didn't pay or they didn't pay correctly, that the officers that respond to those calls know how to treat that person with dignity and understand that it's an illness that's driving the behavior and not criminal activity. We're also working with the team at the Department of Children and Families to ensure that when somebody who has those extreme behavioral challenges and agitation does not experience something called a Baker Act. If you're not familiar with that, it's a piece of action that means that your loved one might be taken to the hospital. They're usually given chemical sedation and they're held for a period of time, and it almost never results in a good outcome for the person with dementia. So we really want to make sure that we have a better protocol for that. So we're working very closely with that team. In every instance, we look for opportunities to make this work sustainable and scalable to ensure that these efforts make their way to the people and places where they will have the greatest impact. And we also work really hard to measure the impact so that we can better understand what works and then do more of it. Because the number that keeps me up at night is 580,000. There are 580,000 people across the state with dementia, and we just have so much more work to do. So even though I just had 12 pages of things that I told you we're working on, it's not enough, and I want to do more. And I really want us to be able to understand which pieces are effective and where we can plug in and do a better job. And so we're going to be working with an insurance company in the coming year to analyze through a randomized control trial the insurance claims associated with hospital visits so that we can better understand if there's an opportunity to partner with health systems to reduce the cost burden to the state of Florida to do all this good work. So I often joke that I am trying to work my way out of a job, but in all honesty, I'm not joking. I can't wait for the day when we don't need people who work in this special niche area of aging. Because I hope that one day this Alzheimer's disease thing becomes just a thing of the past. But until that time, you have my commitment, my personal commitment, and the commitment of our team that we're going to do everything that we can to improve the support systems that exist around you. This is hard work, and it's immensely complex problems, and there are no shortage of roadblocks. If you've ever worked with the government in any capacity, you know that those roadblocks are there, literal and figurative, both. But it absolutely pales in comparison to the tireless dedication that each of you are bringing to your individual caregiving space. So please know that we are here with you and for you, and your stories and commitment are what inspire us, and they help us advocate for the resources that we want to continue to bring around us. So I want to close with this quote. It's from the philosopher Lao Tzu, and it says, "Being deeply loved by someone gives you strength, while loving someone deeply gives you courage." As we care for our loved ones, we find the courage to continue providing support, no matter the challenge. So I want to thank you for everything that you do. Thank you for being here, and thank you for letting me be with you.